Hey, what's up, everybody? Welcome to today's wellness workshop. Today, if you see right in front of me here, I have some orthotics. I have the foot and ankle model, and that's what we're going to be talking about in today's workshop. We're going to be diving into other things that chiropractic care can help with aside from just spine. Oftentimes we hear headaches, neck pain, low back pain is what chiropractic care is for. But we're actually going to jump into something I'm really passionate about, and it kind of drove me along my way to the mentor that I have and the extremities of the body, and that happens to include our shoulders, our elbows, and our wrists, our hips, our knees, and our ankles, and also our jaw. But we're actually going to start from the ground up, talking about some foot and ankle things that come along that we see in our office, and again, hopefully to inform you there are other things just aside from spinal complaints. So again, do us a favor, like us on YouTube and on Facebook. That way, and also you can subscribe. That way you get up to date whenever we post these workshops on Tuesdays or anything else that we post along the way to keep you well informed. So as I said, we're going to be talking about today the foot and ankle. And this could go on and on and on, multiple layers here that we could talk about. I am going to talk about some orthotics, what we see, what are the questions that we ask, and things that you can use orthotics for, why you may need them, but then also what is one of the most common injuries that we see with the foot and ankle. So that being said, in the foot here, the ankle, there are 26 bones in each foot. There are 206 bones in the body, so if you know that, that is 25% of our entire skeleton is actually in our shoes. So a lot of important features to this. There are 3 arches to the foot. You're going to see the medial, which is the inside, the lateral, and also the anterior transverse ligament. So arches of the foot. These are going to be addressed in some of the orthotics that we talk about, maybe also orthotics that you've seen in big box stores such as Walmart, grocery stores, and things, and maybe even podiatrists as well. Again, I am not a podiatrist, but I'm just going to share with you some of the things that I've seen in our office and we have pretty good outcomes with. So, of that, one of the most common injuries that we see, especially given this time of year coming up, I can't believe we're almost halfway through August, and we're going to be talking about football, volleyball, cross country, other sports, fall sports, soccer, that we see an inversion ankle sprain. And that's the most common sprain that we typically see. Also, one of the most common injuries in sports is where we basically go from the inside out and roll our ankle or sprain our ankle. And you may hear things like a high ankle sprain. Some of the most common sprains to the ligaments that we see have to deal with the ATFL, which is the anterior talofibular ligament, and also the CFL, the calcaneofibular ligament as well. So, what does all that mean? Well, it's pretty simple. If this rolls to the outside, we're going to sprain the ligaments on this side. Now, one of the things that we do a lot in our office, number one is to rule out that there's any fracture. So when we do that, what's the next protocol that we see? Well, we know from actual medical research articles that early mobilization or range of motion, as long as there's no fracture, that actually aids in healing. So oftentimes if I see an athlete who may have rolled their ankle, maybe it's really black and blue, and we roll out with an x-ray that there's no fracture, then we're pretty much cleared to adjust that. Now again, if there may be a ligament tear, that's something, us doctors, we need to diagnose to make sure that's not the case either. But as long as we're good with that, early restoration to the proper joint alignment aids for our best healing. That's going to help get the swelling out of there. It's also going to help nerve and blood flow to heal the injury. There are other things that we can throw on there as well, or use, I should say. Cold laser therapy is another thing to help promote the healing. Maybe you're a coach watching this, maybe you're a parent, and we always hear this: how can we get the athlete back on the field as quickly as possible, as safe as possible? And one of the best outcomes that we see with the foot and ankle is doing such, maybe an adjustment, maybe also cold laser therapy. So really fun to actually care for and treat. It's exciting, especially athletes. They're usually pretty intense and want to get back on the field as quickly as they can. Again, myself suffering from an ankle sprain in high school when I was playing football. I mean, it was terrible. It's heartbreaking. You want to get back on the field. I remember that to this day. Super painful, and we got back on the field as quickly as we could. I do wish at that time I knew a chiropractor who did what I know how to do now, and Dr. Helms as well, and maybe we could have got back healthier and faster. So, other things that we wanted to talk about here. Orthotics. A lot of questions about these. So, the ones that we have here, the brand that we use is called Foot Levelers. One thing I want you to know about orthotics is typically these can be subdivided further, but there are functional orthotics and rigid orthotics. These are functional. You'll see that I can pretty much bend this all the way through here. It almost would remind you of an insole that comes in your shoe, except for the padding that supports the normal arches of the foot. So how we handle this in our office is we do a foot scan, a 3D foot scan, so we know how much pressure and where the pressure is being placed on the foot. We just don't immediately go right to ordering orthotics then. We want to make sure, is there an arch in the foot? Is it a flat foot? Is it normal? Because if you think about it, if we have a flat foot, I don't want to put something in there just going to support that. I want to help restore some of that arch in the foot, and then we support it. So what we'll often do is after a few weeks, maybe a month or so, we'll rescan the foot so it helps support the healthy, normal arch of the foot, not just quote-unquote casting. I say casting a bone in a broken spot, but casting a bad arch. Maybe it's flat, maybe it's too high, and whatever that case may be. Why I reference functional orthotics is, in my belief and philosophy, there's 26 bones in the foot like we talked about in the ankle. We want to make sure there's a lot of movement there as you go from heel strike, mid stance to toe off, not just that we go heel, mid, and then to toe off. So we want to make sure there's a lot of good movement there, but again, that it's supported, and most importantly, that it's comfortable. So that's the one thing. I don't have a rigid and orthotic in front of me, but if you've ever seen those, they're typically like a hard piece of plastic, almost as rigid as this iPad here. And to me, I just don't feel like it's a comfortable thing to stand on that alone, let alone maybe do sports in it, run, jog. A lot of extreme runners use orthotics. So the custom orthotics versus something you may see perhaps in a big box store where maybe you just get pigeonholed into you're either A, B, or C, or 1, 2, or 3 of normal foot, flat foot, or high arch. We want to make sure it's custom to you. Shelf life on these could be anywhere from 1 year to 2 years. Just depends how often you wear them and what you wear them in. I think I speak for most people here that if you have orthotics, you should wear them in every shoe, not just when we're on our feet for a prolonged period of times, but even not just at work. The example there that I see a lot, especially people who work with construction boots or steel-toe boots that are only for work, but also on the weekends and the evenings when you go out, over weekends when you work out, things like that, you should always be wearing those. So, again, in recap, there's a lot of things that can go on here in the foot. Tarsal tunnel syndrome, other things such as metatarsalgia, bunions, Morton's neuroma, a lot of other things that we handle and deal with. One of the other most common things I left out was plantar fasciitis. We actually have a high success outcome with this in improving plantar fasciitis. There are a few other things that we may use, such as some shockwave technology. Again, maybe the cold laser, just depends on the scenario. Also, if there is maybe a heel spur in there. But we see a lot of success with that, with adjusting the foot, avoiding surgery, avoiding injections such as cortisone, but actually restoring the proper joint alignment, just like we talk about with restoring our spinal alignment as well. So I hope kind of getting away from the spine here, talking about other extremities. These are more conversations in our wellness workshops that we're going to do. I hope that you found this interesting. Again, if you're a parent, a coach, if you have any questions, don't really reach out to us, because especially with fall coming, we see a lot of these injuries happen with our athletes, but also the normal person. Maybe we're walking on a sidewalk and we step on a rock and we roll our foot there as well. So I hope that you can relate to this, share this with anybody you may know if you think that that's a case that you've heard of, plantar fasciitis, ankle sprains, and such. Again, even the orthotics conversation too. So as I said earlier, thank you for attending. I hope you found this information valuable. Again, subscribe, like our Facebook and YouTube page. That way you can stay up to date with the most relevant information that we put out for you. Thanks, guys. Have a great day. Everybody, hope you enjoyed that spinal workshop. Don't forget to like the video and feel free to share it if you learned something. Be sure to subscribe to our channel so you have quick access to our videos, and also don't forget to hit that notification bell so you are alerted every time that we post a video. You can also check out other spinal workshops by clicking right over here. Until next time, make sure you live your best life, and we'll look forward to seeing you at that workshop.